Let me do a roll call.
You're good to go.
Okay. Shall we call the meeting to order?
Okay.
We'll take a quick roll call of attendees, please.
Joe Tennyson,
Yep.
Jim Griffith,
Yes.
Robin Williams. Robin, you there?
She's on mute.
Okay. John Garside.
Director here. And
All right.
Tina Nolan.
Tina Nolan, clerk. Okay, John.
All right. So I guess we should start with looking at the minutes. Has everybody had an opportunity to review the March and April minutes? Robin's got to come off mute if she wants to answer.
Yeah, so Robin, if you do a mouse over, you should be able to see the microphone picture. If you just click on it once, it should unmute you. I did not unmute her. I did not mute her. There's a new attendee.
Okay,
hello?
can you hear me?
Yeah.
So I'm using my boyfriend's computer, which doesn't have a camera and it doesn't have a microphone. And he's trying to work on my other computer so that I can, this is weird because I can hear myself.
Right. Turn off the sound on the computer.
I don't know.
Well, Robin, you can just call in on those numbers I gave you
Yep.
too on the phone.
Yeah, now I'm on the phone here.
Yeah, that's where she's at
So that
now.
should be, okay, hold on a second. Can you hear me? Can you hear me?
Yep.
How about now?
Yep.
Yep.
Okay, so I can hang this one out.
Yeah, I'm not sure what happened, but she got muted again. We can hear you, but you're extremely low. Yeah, she's talking, guys, but she's very, very, very low.
Can we get it? Is she on the telephone, Scott?
No, she came onto the Teams using her laptop or computer, and then she came off of her phone.
At this point, we should try the phone, I think.
Just mute the sound on the laptop so you don't get the echo. Yep. Well, microphone's muted.
Yeah, if you can hear this, I would just say just call in. I'm not sure. Is there anything you guys going to be presenting anyways?
Nope.
No.
So, I mean, it'd probably just be best. Okay, I just admitted her.
You're back.
Hey.
Okay.
All right.
So has everybody had an opportunity to review the minutes from March and April?
Yes.
And is there a motion to accept or any concerns or comments for the minutes?
Jim Griffin would certainly makes a motion to accept.
And Robin Williams seconds that motion.
All right.
Okay.
All votes have to be, and so we'll take them one by one. Everything has to be a roll call. So for the March minutes, I forget the exact date. I have it here somewhere. All in favor of approval of the minutes as written?
Okay. Joe Tennyson,
Aye.
Jim Griffin,
Yes.
Robin Williams.
Yes.
Okay. So those are accepted, and then we will take that motion as having been for both of them, and we'll say for the other set of minutes, which are April 6th, those all in favor of accepting those minutes as written.
Joe Tennyson,
Aye.
Jim Griffin,
Aye.
Robin Williams.
Yes.
Thank you.
All right.
Are we set with that?
That was that. So on to you, John. What do you got?
Just an update regarding coronavirus, if I can. Start with our numbers. So we're averaging 2.42 new cases a day over the last week, whereas a few weeks ago we were 19 cases per day was our average. So significant progress in that regard. The number of active cases is currently at 101, which is the lowest since the beginning of April. So the numbers have been trending downward significantly in the last 2 to 3 weeks. We continue to hand out masks and update our website and conducting Zoom meetings with the Chamber of Commerce, the COA, and WMCT-TV this week in regards to getting the word out and prevention, public relations. Phase 2 of the reopening for the health department consists of working with restaurants and all other businesses in town and city rather that have questions or need advice on how to comply with the new requirements. Highlights of the phase 2 reopening include retailers being limited to 8 persons per 1,000 square feet or 40% of their occupancy. Outdoor public and semi-public pools can reopen at 40% of their approved capacity. Indoor pools can be used by kids under 18 years of age and in association with summer camp or youth league. Hot tubs, whirlpools remain closed. Day camps for children can resume with COVID precautions. Restaurants, in addition to takeout and delivery, may offer outside dining with conditions, such as 6 feet must be maintained between tables. Single-use or electronic menus are to be used, and face coverings should be worn when patrons are not seated at their table. The licensing board is processing 24 restaurants this evening in regards to additional or new outside seating. Organized adult and youth sports are now allowed, providing there's no contact, no games. Indoor facilities are limited to use by youth programs only. Funeral homes can function at 40% capacity, and some personal services that do not involve close contact, such as tax prep and tutoring, is allowed in phase 2. Hotels can resume taking guests with no functions or meetings. And that is what I have on Corona update, and I would ask what other folks are seeing, if I could.
So Jim, you're at Marlborough. I'm not there these days. So how have things been? It sounds like the COVID volume in the unit has been improving.
The COVID volume in the unit is improving. We have 2 ventilators that are COVID positive. We have 1 ventilator that is COVID negative. Granger 1, I don't know the actual number Dr. Tennyson, but I believe that that is still 100% COVID. I'm picturing the list from Epic, and I'm estimating between 10 and 15 inpatients at that point. I don't know if there are any on 2. I didn't have anything up there today. I'm actually still here, which is why I'm on the phone. The ER has been quite busy still. I don't know what the percentage is of the admissions. You might have a better handle on that number than I.
So I'm not
if
sure.
It's not, if they aren't acute, they don't call us.
Right.
But you know, I was not called there at all today.
I spoke to Dr. Costigan earlier today, and she said that it's been going along steadily. We're still, all of our ERs across the system are operating at significantly lower than normal volume. We've seen some uptick, you know, but still, you know, Marlborough's seeing things in the 40s and 50s where normal volume would be 74 a day. I'm not sure what the numbers were like over the weekend. I know that we're completely out of surge spaces. So we are back into normal operating spaces at all of the community hospitals. The update this morning said that we had, it must have been at Marlborough, 1 ICU bed available, because I know it wasn't at Health Alliance because that place is locked.
Yeah, there's now 2 because we had 1 patient who expired.
So we've got space. The number of patients we're seeing per day that need COVID testing, well, we still test virtually everybody because it doesn't take much. You come in with a fever for any reason and you get tested. So we're testing a lot of people, but the number of positives we're getting is declining rapidly. I'd be actually interested if anybody's publishing out there an R0 level, which I don't know if it's been published, but you know, that's the replication or reproduction rate, and the goal, of course, is to get that below 1. Last I heard was the governor, and that was a couple of weeks ago, talking about it still being over 2 or over 1, close to 2, I think. So that's the number we want to get, less than 1. When that number is less than 1, you know it's dying off and not growing. Essentially, that means that for every person that has the disease, how many people are they likely to give it to? So, but all that aside, the numbers we're seeing are decreasing dramatically, which is quite reassuring.
Now, the number of tests are going to increase, though, starting next week, at least because the pulmonary function lab is going to reopen, and each patient that's being tested needs to be tested for COVID first. So I'll be interested to see what that does with the percentage of positives, because the denominator is going to be markedly increased.
Right, and that's for all outpatient services. I was just looking up a patient for another case at Health Alliance who has an outpatient neurology appointment tomorrow for follow-up and was seen in our tent and tested today, because prior to ambulatory appointments, surgery, everything, people are now getting tested to clear them. We also have the saliva testing available now when we're running that through both of our tents. So that is decidedly less noxious than the swab in the throat and nose. I've now been swabbed twice, and it's not fun. It's definitely not something I'm signing up to do repeatedly. So the saliva test will help, and it's also going to help with speed and with staffing. It just takes a lot fewer people, and does not require the same level of trained staff to collect the saliva samples, or PPE for that matter, than does the swabbing. So
Now, does the saliva test need to be done in Worcester, or can that be done in the community?
I believe it's being run on the same PCR test. It's just they've validated that it's okay to take it by saliva as opposed to a nasopharyngeal swab. We're still using nasopharyngeal and oropharyngeal swabbing for clinical patients, suspect patients, because we think the sensitivity is just a little higher, as I understand it, although I haven't seen those numbers. But it's run on the same machine. So at Marlborough, they won't be able to run it. It'll have to go to Worcester. Health Alliance, we have a PCR machine, but it's not up and running yet.
Good evening, Kristen. How are you?
Yeah, the lab has an amazing process in place for transporting the samples from Marlborough to Worcester.
Yeah, regular couriers and times so that we don't have any of the like tent tests that show up after the couriers left, so that we get everybody processed as quickly as we can. I think the most reassuring thing I've seen is on the state's dashboard, as you see those daily new diagnosis numbers continue to trend down. That makes me very happy. I will say that, so I'm no longer the ordering provider for all of the not previously ordered tent tests at Marlborough. That goes to Dr. Costigan now, but I do that at Health Alliance now. And the percentage of those tests coming back positive has decreased considerably. In fact, none of them positive on the bunch I looked at this morning.
And I believe that Dr. Laudeza has been signing the orders for the PFT patients. Yes.
Usually, I mean, preferably it's by somebody from the clinic or whatever, wherever they're going, the pre-testing orders. Have we had many patients go through on my order from the board?
We have not, Doctor. As you know, the numbers have been way down since you've been issuing your order on behalf of the board. So, and generally the couple that have gone through there have worked. There's been a hiccup or two, but I think the algorithm, as someone called it from the hospital, seems to be in place. And so far so good. I'd like to see, I was just saying at the staff today, I'd like to have sent a dozen folks up there to see if, you know, how it's working. But, you know, the few we've sent up there were probably 2 out of 3, you know, and the third one, we're not exactly sure what happened to her in regards to did she get tested or not.
Just to update the board on that, the health system, UMass Memorial Health System, is trying not to do any of the tracing tests without an order from somebody. So just because of a concern for preservation of testing supplies and that sort of thing. So what we did for those that are contact trace positive and are the responsibility of the Marlborough Department of Health, I issued an order so that they now have a doctor's order for the test. So that's for those that don't already have a primary care. If they have a primary care, they can get their primary care's order. But if they don't have a primary care, this way they don't have to find some other third party to test them, like CVS or some other place, where a lot of these folks don't have. The ones that don't have primary cares also don't have insurance, often don't have transportation, and us asking them to go find some other testing site usually means they're not going to get tested. Whereas this way we can make sure it works.
And thank you for that, Doctor. That certainly was a good kind of solution. A compromise seemed to work so far.
Yep. All right, any other updates?
Doctor, I would go into a couple other updates if I could switch gears a little bit.
Certainly.
We have Regional Tobacco Control District has been approved by DPH. It's a 13 community district consisting of Ashland, Framingham, Holliston, Hopkinton, Hudson, Marlborough, Medway, Millis, Natick, Norfolk, Southbury, Sudbury, and Wayland. So the funding's been approved. Before too long, a full-time regional tobacco control manager will be appointed or hired, which will allow the community's additional compliance checks, youth access, and education resources. So we're looking forward to that. In regards to tobacco control, the governor signed into law, the Act Modernizing Tobacco Control in November, and one of the things that did was on June 1st, it prohibited the sale of flavored tobaccos or any tobacco products that have a characterizing flavor, e.g. menthol cigarettes, flavored chewing tobacco, those types of things. So that was effective on June 1st. So things continue to run, in addition to COVID, things continue to happen here. We're all continue to wrestle with the opening and reopening and phased reopening, but at the same time, we try to stay the course on some of the other stuff that we do. In regards to EEE, which mosquitoes are back, as you might have noticed, we being in critical risk area last fall, that does warrant us doing increased larviciding in May, which has been performed in the city, and then into June, adulticiding typically and historically takes place, and it's Wednesdays, the month of June, as requested by property owners. And as you probably know, you can exclude yourself from that type of application as well. I would just mention that Tina's principal clerk position looks like it's been favorably reviewed by HR. So that was a move from senior clerk to principal clerk. And the mayor seems to also be in favor of it. It needs some council support and or transfer of some funds, but we anticipate and hope that that'll be approved real shortly here.
Excellent. Well deserved.
Yeah, so that was good news. And as you know, she's been here for the last 2.5 months or whatever it is. A lot of late nights, weekends, even now as we're not in the we're not at the peak of this, but still Tina's she's on Saturday and Sunday running numbers. So we certainly appreciate that.
Thanks.
We have interviewed a public health nurse candidate. She seemed to be a pretty good candidate, and she withdrew her application shortly after the interview. So we're back accepting candidates, and we'll see how that develops over the next week or two. Whether there's a need to try to throw some more salary at that item. We're doing salary surveys as we speak because there just wasn't a lot of applicants, and I think that's just kind of the world we live in right now. So, and for example, the nurses that have been working with us from the school department, you know, a job like this, as much as I know some of them like the work, it just doesn't make sense given the salaries that the school department can provide versus what, as a public health nurse in Marlborough, at least, and perhaps in comparable communities, we're still running through those numbers.
The candidate who withdrew her application, did she give a sense as to the reason?
She stated family, but you know, I don't know that we. Is a very well-schooled candidate. She had been out of public health for about 5 years. He's in a doctorate program. But, this is a boots on the ground job too. So I personally wonder if, some of that, the reality that, you're the person and there'll be assistance and some intern help or maybe a part-time person down the road. But, we expect you to hit the community running and work in some neighborhoods regarding health equity. And I think I mentioned, a Friday night or a Saturday morning on occasion, to try to make some progress in some of those areas. And so it's a lot to do what it takes, as you folks know. So,
Yes.
And I'm sure she did have family commitments as well that didn't make sense for her, but I just wondered if, so.
Yep.
We'll continue that search. And I think that's all I have.
Mr. Chairman, if I could ask a quick question. This is Jim Griffin.
Yeah, please. Sorry.
I was approached by a member of the organizing committee for the world famous Greek festival here in Marlborough, which is held every Labor Day weekend. And she was asking, number one, if I had any idea as to whether or not it was going to be allowed to be done. Number two, she asked for a contact person that the committee or the priest at the Greek church could reach out to get a little bit of guidance, because this is an event that I don't know if you've ever been there or not, but it's pretty huge. And it takes a little bit of time and commitment to plan it, and they really don't know what to do. So I don't know if Mr. Chairman John could give a little bit of guidance as to what I could let these folks know. They have a conference call themselves going on from 7:30 to 8:30, and I told them that I would touch base with them again later this evening. So any guidance there would be helpful.
Absolutely. Whatever you can do for them, John. I think the primary thing is that our hands are very much tied to what the governor does and the rate at which he does it, as far as when we start permitting outdoor festivals or large gatherings like that. But I'm sure John's going to have more specifics on that than I am.
Yeah, I think festivals are in phase 4, which I think that would push them through. I mean, would be in theory, we would be in phase 4 by Labor Day, but who knows, I guess, the real time frame, if we're holding those dates or not. So that would be a guessing game. I mean, the festival as they know it, I wouldn't think so. But they can certainly contact myself and Tina in the office as contact folks. But it's hard to, I know you need to know, but it's hard to plan for something like that when you don't really know.
Right.
We're not even
Okay,
going to know what phase 2 did for us for 2 to 3 weeks until we start seeing numbers change.
So you'd be comfortable, John, if I gave them your name and office phone number, or Tina, to have them at least have somebody they could ask. That's
Sure.
all. They want to do the right thing, and
No problem. Yeah, as you might imagine, that's a lot of what we do day to day here. And a lot of it is brainstorming too, because not everything fits into that little square box. So, and as I'm sure Robin can attest to, the guidance that just keeps coming and coming, and to keep it all straight. And sometimes a day later, it's not exactly what was presented the day before. So, a little bit of a challenge.
she only approached me because she's a nurse in the OR at the hospital, and she knew that I was on the board, so she came down today and asked.
Sure.
And I told her that I would bring it up this evening.
Yeah, actually, it's funny you talk about festivals. We really haven't had that question per se. I don't know if most folks don't need, like most folks want, what's it now? June 8th. So most folks want a couple months to plan, right? I'm surprised we haven't heard more.
Yeah,
I
this
know
is,
a lot
I mean,
of the bigger festivals are canceling.
Yeah. And our
Yeah.
smaller ones.
well, I think we all know Marlborough's connection with Labor Day. And I think the committee at that particular institution is just trying to figure out how they're going to fit in this year. I think that's all.
Yeah, I've always wanted to go to that, but I never have. I love the Greek festivals historically, but that's a good one. It's a big one.
It's huge.
Now it all takes place at the church, or is it other places?
Well, there's a yes. Short answer, yes. They have a small little outdoor area beside the church, but the majority of it is a common eating festival.
Yeah,
It's food
right.
that's served cafeteria style
Perfect.
on picnic tables that are basically in rows next to each other.
And lots of
So
wine.
it's a perfect storm as far as COVID-19 goes, I'm afraid. But they are trying to do the right thing, and I applaud them for that.
Mhm.
Okay.
Right, any other new business? All right, then I guess we will entertain a motion to adjourn.
I would be happy to make that motion unless we should make the date for the next meeting first.
We should. Then you know what? I've got my calendar up for that exact purpose, and then I forgot to go back and ask it. So, what looks good?
I'm away the week of the 13th, July.
So, how about is the 6th okay? Is that too tight on the holiday weekend for people, or?
I'm okay.
Unfortunately, I'm working that weekend, so it's fine for me.
Robin, is that good?
Yeah, it's fine.
Okay. Why don't we go with this July 6th at 6:30? I don't expect it'll be a very long meeting, but I think we want to keep up to date on how things are changing and such.
Yep.
Perfect. All right, then I will make the motion to adjourn.
And I will second that motion.
Okay, so the roll call vote, Joe,
Yes.
Jim,
Yes.
Robin.
Yes.
Awesome. Thank you.
Thanks, guys.
All right. Well, thank you all. Stay safe.
Nice
Good night.
to see you.
Bye.
Pleasure.